So today we are going to discuss how to choose antibiotics. So before initiating our discussion, I would like to ask you a few questions, okay? And then we'll start our discussion about antibiotics. So my first question is, this is true or false question, okay? The question is, fourth generation cephalosporin is mostly active against gram-negative and somewhat against gram-positive and anaerobe. So is this correct or false? So this is false, because third generation and fourth generation cephalosporin are not effective against anaerobes. Only fifth generation cephalosporin is somewhat effective against anaerobes. Only somewhat effective, okay? So this is the first question. And next question is a scenario. A 45-year-old female was admitted in ward for SLE flare and she has been treating with immunosuppressive medications, and on fourth day she developed hospital-acquired pneumonia, okay? And the doctor thought to start antibiotic, okay? And he thought to start antibiotic combination, okay? So let me know whether this combination of antibiotics is correct or not correct. So he thought to start piperacillin tazobactam plus meropenem. If you think it is not correct combination, why it is not correct combination? And another doctor thought to start this combination, piperacillin tazobactam plus levofloxacin. So actually this is not correct combination and this is correct combination. In which sense is this correct combination and this is not correct combination? Because these both are cell wall active against antibiotic acting against cell wall, but this is acting against DNA replication and this is acting against cell wall, okay? So remember this point. Whenever you prescribe two antibiotics, you have to choose two antibiotics from different class. Don't prescribe two antibiotics from the same class. Why? Because let's suppose that bacteria develops resistance against cell wall synthesis inhibition. So the both antibiotics will be not effective and patient may further progress and go into sepsis and septic shock, and it also promotes multi-drug resistance organisms. So always start combination of antibiotics from two different class, okay? So you can start cell wall synthesis inhibitor and protein synthesis inhibitor, or cell wall synthesis inhibitor and DNA replication inhibitors. Like that combination will be correct combination, okay? To prevent MDR organisms and to treat organisms, okay? And my third question is, this is also true or false question. This is about macrolide. So macrolide covers gram-positive, gram-negative, atypical and anaerobes. So is this correct or false? This is false, because macrolide does not cover anaerobes, okay? If you think that patient may be having anaerobic infection, you have to add another antibiotic that covers anaerobes, okay? So macrolides are generally used for atypical organisms. Macrolides are quinolones. So regarding macrolide and quinolones, both are used for atypical organisms. But what is the basic difference? If you have to choose one antibiotic among macrolide and quinolone for atypical, which one will you choose and why? So the first choice will be quinolone and second choice will be macrolide. Why? Because quinolones are bactericidal. Quinolones are bactericidal, but macrolide is bacteriostatic. Macrolide is bacteriostatic. So it will just halt the growth of bacteria, but it will kill the bacteria. That's why the first choice will be quinolones, okay? So now we are going to start our discussion of antibiotics. So before that you have to learn about what are the types of bacteria which falls under different classes. Okay, so basically I will be dividing here 4 classes of bacteria: gram positive, gram negative, atypical, and anaerobes. So this is gram positive. So which please tell me some gram positive bacteria. You may be thinking Staphylococcus, correct? Pneumococcus, Enterococcus. So these are some gram positive bacteria, and please tell me some gram negative bacteria. Pseudomonas. You may be thinking Enterobacteriaceae, H. influenzae. And tell me something about atypical. Some bacteria that falls under atypical: Mycoplasma, yes. Other Legionella, Chlamydia. And what is atypical about atypical bacteria? The atypical about atypical bacteria is that it does not have cell wall. It does not have cell wall. And I told you this fact. And I am now asking you one question. Is meropenem effective against atypical bacteria or not? Is Piperacillin tazobactam effective against atypical bacteria or not? No. Why? Because those are cell wall acting agents. They inhibit cell wall synthesis. But this does not have cell wall. So it will be not effective against cell wall. This type of bacteria, okay? Now, so tell me some anaerobic bacteria: Clostridia, Bacteroids, okay? So these are some basic things that we already know, and now let's discuss properly about antibiotics. So we will be classifying antibiotics based on the mechanism of action. So I am writing now cell wall acting agents, and here protein synthesis inhibitors, and here I will be writing inhibitors of DNA replication. So tell me some antibiotics that act against cell wall. Beta-lactam, correct? Another glycopeptides, correct? Which include vancomycin, teicoplanin. Another daptomycin, correct? Another colistin, polymyxin B. Okay. Now tell me some protein synthesis inhibitor antibiotics. Aminoglycosides, rifamycin, macrolide, tetracycline, chloramphenicol, clindamycin, linezolid, nitrofurantoin. Okay, let us stop at this. Nitrofurantoin. Now let's tell me some antibiotics acting against inhibitors as inhibitor of DNA replication. Sulfa drugs, correct? Another quinolones. Other metronidazole. So why do you need to this separate class of antibiotics? Because whenever you prescribe antibiotics, you have to combine 2 antibiotics from 2 different class. Don't combine antibiotics from same class, as the reason I already told you in the beginning of this discussion. Okay, so that's the importance of knowing this. Now let's start with penicillin. So in penicillin there are different antibiotics like aminopenicillin, and aminopenicillin combined with beta-lactamase inhibitors, You very well know the examples aminopenicillins like ampicillin, amoxicillin, and beta-lactamase inhibitors are clavulanic acid. So amoxicillin plus clavulanic acid, ampicillin plus sulbactam are aminopenicillin plus beta-lactamase inhibitors, and extended spectrum penicillin. Extended spectrum penicillin includes piperacillin, and when we combine this with beta-lactamase inhibitor like tazobactam, then it becomes piperacillin tazobactam. Okay. Now we will be discussing individually each antibiotics and discuss whether which antibiotics is effective against which class of bacteria. So we will be starting with aminopenicillin. Okay, but before starting it, I will like to tell you some 3 signs that I will be using in this video to denote whether that antibiotic will be effective against that class of bacteria or not. Okay, so the 3 signs I will be using. Go means it is fully effective against that bacteria. That antibiotic is fully effective against bacteria. If I write like that, this caution, it means it is somewhat effective and somewhat not effective. Somewhat effective and somewhat not effective. But if I denote with this symbol, it means it is not effective at all. Not effective at all. Okay. So now let's start with aminopenicillin. Aminopenicillin, that include amoxicillin, ampicillin. So I am writing here caution. Caution, it means it is somewhat effective against gram-positive, negative, anaerobe. Okay. And I don't need to tell you that these cell wall acting agents are not effective against atypicals, because that does not have cell wall. So don't talk about cell wall, don't talk about atypical bacteria and these cell wall active agents, because I am discussing cell wall acting agents. And do you think protein synthesis inhibitors are effective against atypical bacteria? Yes, if that protein synthesis inhibitor antibiotic inhibits protein synthesis of atypical bacteria, then that will be effective. But all protein synthesis inhibitors are not effective against, because all protein synthesis inhibitor, all classes of antibiotics can't inhibit protein synthesis of atypical bacteria, and I will be discussing that later. Okay, but at present I am discussing cell wall acting agents. So aminopenicillin, caution against gram-positive, negative anaerobe. It means it is somewhat effective against all 3 classes of bacteria, somewhat effective. And aminopenicillin plus beta-lactamase inhibitor like amoxicillin plus clavulanic acid, ampicillin plus sulbactam. So go gram-positive and anaerobe. So it means it is fully effective against gram-positive and anaerobes, but caution against gram-negative. It means somewhat effective against gram-negative. Okay. Now let's talk about extended spectrum penicillin. Extended spectrum penicillin like piperacillin. So caution, it means somewhat effective against gram-positive, negative, anaerobe. But when we combine this with beta-lactamase inhibitor like piperacillin, tazobactam, then go, it becomes go signal. It means it is fully effective against gram-positive, negative, anaerobe. So piperacillin, tazobactam is fully effective against gram-positive, negative anaerobes. Okay. So remember this signal, because I will be using this signal throughout this lecture. Now let's talk about cephalosporins. So as we go from first generation cephalosporins to fifth generation cephalosporin, this, as we move forward, it will be more effective against gram-negative and less effective against gram-positive. You have to remember this. As we move forward from first generation to fifth generation cephalosporin, it will be more effective against gram-negative and less effective against gram-positive. Okay. So let's start with first generation cephalosporin. First generation cephalosporin is somewhat effective against gram positive but not effective against gram negative anaerobes. Not effective against anaerobes and gram negative. And regarding second generation cephalosporins, it is somewhat effective against gram positive negative anaerobes second generation cephalosporin is somewhat effective against gram positive, gram negative and anaerobes. And third generation cephalosporin and fourth generation cephalosporin, these are fully effective against gram negative, somewhat effective against gram positive and not effective against anaerobes. Both third and fourth generation cephalosporin. But regarding fifth generation cephalosporin is somewhat effective against anaerobes and fully effective against gram positive and gram negative. Okay, so fifth generation cephalosporin, go signal for gram positive negative but caution signal for anaerobes. Okay. Now let's talk about carbapenems. Which include ertapenem, meropenem, doripenem. Okay. So let me write carbapenem. It is fully effective against gram positive negative anaerobes. So if you start meropenem, you don't need to add separate antibiotic to cover anaerobes. Okay. Aztreonam is only effective against gram negative. So when do you use aztreonam? Aztreonam is used instead of aminoglycoside when there is nephrotoxicity due to aminoglycoside and you have to cover a gram negatives, then you can use aztreonam. Okay, because it is only effective against gram negative. And let's talk about glycopeptide. It is effective against gram positive, fully effective against gram positive, but somewhat effective against anaerobes and not at all effective against gram negative. Okay. And daptomycin is only effective against gram positive, and colistin is only effective against gram negative. Okay. Now this was all about cell wall acting agents. Now we are starting with protein synthesis inhibitors. I already told you rifamycin, aminoglycosides, macrolides, tetracycline, chloramphenicol, clindamycin, linezolid, nitrofurantoin. So let's start with rifamycin. So it is somewhat effective against gram positive and not at all effective against gram negative, anaerobe, atypical. Okay. Aminoglycosides, it is fully effective against gram negative, somewhat effective against gram positive, and not at all effective against anaerobes and atypical. Anaerobe, atypical. And regarding macrolides, it is somewhat effective against gram-positive negative atypical, gram-positive negative atypical, and not at all effective against anaerobes. Okay. Now let's talk about tetracycline, which include doxycycline, penicillin. So it is fully effective against atypical tetracyclines and somewhat effective against gram-negative anaerobes, gram-negative anaerobe, and it is not at all effective against gram-positive. Okay. Now let's talk about tigecycline. So tigecycline covers all gram-positive negative anaerobes atypical. But what is the limitation with tigecycline? It is bacteriostatic. It is not bactericidal. And tigecycline also does not cover pseudomonas, but it covers methicillin resistant Staphylococcus aureus. Okay. So that is about tigecycline. And what about chloramphenicol? So chloramphenicol is effective against, fully effective against anaerobe atypical. Anaerobe atypical, somewhat effective against gram-positive negative. Okay, chloramphenicol is not often used in our daily practice. It is used when multiple drug resistance is suspected and fever is not resolving despite trying various antibiotics. In only that scenario we can use chloramphenicol. Okay. Now another protein synthesis inhibitor is clindamycin. So do you know in which class of bacteria clindamycin is effective? Clindamycin. So it is somewhat effective against gram-positive anaerobe and not at all effective against gram-negative atypical. Not at all effective. Linezolid only for gram-positive. Nitrofurantoin somewhat effective against gram-positive negative, gram-positive negative, and not at all effective against anaerobe and atypical. Anaerobe and atypical. So this was about protein synthesis inhibitors, and now we are going to discuss about DNA replication inhibitors, which includes quinolones, metronidazole, sulfa drugs. Okay, so sulfa drugs are somewhat effective against gram-positive and negative, gram-positive and negative, and not at all effective against anaerobe atypical, anaerobe atypical. Quinolones is fully effective against atypical, gram-negative, somewhat effective against gram-positive anaerobe. So first choice of atypical is quinolone because it is bactericidal. Okay, and metronidazole only effective for anaerobes. So metronidazole we only use for anaerobes, not for atypical or gram-positive negative. Okay, so this is all about antibiotics. This is